Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
You know, it's truly remarkable when you stop and think about it, how the food choices you make today, maybe even just what you had for lunch, could potentially ripple out decades into your future, affecting something as basic as, well, your memory, how sharp your mind stays. We're constantly making these choices, right, in the grocery store, ordering food, often without really pausing to consider the um, the cumulative long-term impact these habits might have on our brain health way down the line.
That long-term view is exactly where a lot of the science is shifting. Researchers are digging deeper into how diet shapes not just, our immediate physical health, but our cognitive path across our whole lives. It's definitely a complex picture, but an incredibly important one.
And that complex picture is precisely what we're going to unpack today. We had a listener share some really interesting material with us. There's a major scientific study published in the journal Neurology, and also a health news article that helps put it all into context. So our mission today is to really get into what this very long-term research tells us about red meat, both processed and unprocessed, and its potential connections to, well, dementia risk and cognitive decline. Okay. Let's dive in.
Yeah, so the foundation here is this really substantial piece of research. It pulls data gathered over decades from two huge, long-running studies in the U.S. You might have heard of them, the Nurses' Health Study and the Health Professionals Follow-Up Study.
Oh, right. Those are very well-known long-term studies.
Exactly. And combined, this effort followed over 133,000 people. Crucially, all of them were free of dementia when they entered the study, and they tracked them for up to 43 years.
43 years. That's just an extraordinary amount of time to follow people and their habits. How on earth did they manage to track what people were actually eating consistently over all that time?
Good question. They used validated tools called semi-quantitative food frequency questionnaires. Sounds complex, but basically, they sent these out every 2 to 4 years throughout the study. This allowed the researchers to build a picture, long-term pattern of what people were eating and estimate their intake of different foods, including, importantly for us today, red meat.
Okay, so they had a pretty solid method for estimating diet over the long haul. Then how did they measure the potential impact on brain health across such a massive group for so long?
They tackled cognitive health from a few different angles, which is a real strength. The most definitive outcome was tracking actual clinical diagnoses of dementia. These were identified through reports from the participants themselves or their families, and then carefully verified using medical records, death certificates, reviewed by a study physician.
Right, so the confirmed diagnoses, that's key.
Definitely. And then, for a large subset of participants, they also used objective cognitive function tests, specifically something called a telephone interview for cognitive status, or TICS. It's a structured assessment done over the phone that measures different cognitive areas, things like orientation, memory, attention, executive function.
Got it. So actual diagnoses and objective tests to see how well the brain was performing. Was there anything else?
Yes, they also looked at something called subjective cognitive decline. This is basically when people themselves feel like their memory or thinking abilities are getting worse. Even if, formal tests might not show a major problem yet, it's often seen as a possible early warning sign or maybe just a different aspect of cognitive change.
That's interesting. So looking at both the clinical side and the person's own perception. Now, a really critical thing the study did, which the sources highlight, was making a distinction between different types of red meat.
Absolutely crucial. The study specifically broke down intake of processed red meat. We're talking things like bacon, hot dogs, sausages, salami, bologna, that kind of stuff. And they compared that directly to unprocessed red meat, which was defined as beef, pork, or lamb, maybe served as a main dish, in a sandwich, or as hamburger.
Okay, good distinction. And they didn't just look at eats red meat versus doesn't. They actually categorized how much people ate, right? Low, medium, high.
That's right, they broke it down. For processed red meat, high intake was defined as having about a quarter of a serving per day, or more specifically 0.25 servings. The lowest intake group had less than about a tenth of a serving daily, so less than 0.1.
Okay.
And for unprocessed red meat, high intake meant 1 serving or more per day, 1.00 servings, while low intake was less than half a serving per day, so under 0.50. Having these categories really lets them compare risks across different levels of consumption.
Yeah, those specific numbers give us a much clearer picture. All right, now for the main event, what did they actually find? After tracking all these people, all this data for decades, what were the key results?
Well, the findings showed a pretty consistent pattern, and it was particularly strong when looking at processed red meat.
Okay, tell us about that. What did they see for the people eating the most processed red meat?
So for those participants in that highest intake category, eating about that quarter serving or more each day, there was a 13% higher risk of actually being diagnosed with dementia compared to the group who ate the least processed red meat.
13% higher risk, over 4 decades, linked to that level of processed meat. That sounds, well, pretty significant.
It really is, especially coming from such a large, well-designed study. And it wasn't just the clinical diagnoses. That same high-processed meat group, they also had a 14% higher risk of reporting subjective cognitive decline.
That feeling that things aren't quite as sharp.
Exactly, that self-perceived decline.
And didn't they also talk about it in terms of accelerated cognitive aging, how quickly the brain seemed to be aging?
Yes, that was another really striking way they analyzed it. Higher processed red meat consumption was linked to what they called faster cognitive aging. They calculated that for every extra serving of processed red meat someone ate per day, it was associated with the equivalent of about 1.6 extra years of aging in overall cognitive function, and even a bit more for verbal memory, specifically about 1.7 extra years of aging per daily serving increase.
Wow. So not just a higher chance of problems down the road, but potentially the brain declining faster along the way, particularly memory if you're eating more processed red meat.
That's essentially what that cognitive aging metric suggests, a potentially steeper slope of decline over time linked to higher processed red meat intake.
Okay. So what about the unprocessed red meat? Things like steak, roast pork, lamb chops, did that show similar risks?
Here's where the picture's a bit different. The association with unprocessed red meat was less pronounced in this study. High intake, remember, that was 1 serving or more per day, was associated with a higher risk of subjective cognitive decline, about 16% higher compared to the low intake group.
Okay, so still linked to that feeling of decline. But crucially, what about actual dementia diagnoses for unprocessed red meat?
And this is a really important point of distinction from the study. Overall, this very large study did not find a statistically significant link between eating unprocessed red meat and getting an actual dementia diagnosis. Now, there was a slight hint, maybe a suggestion of a link, in one specific subgroup, people who didn't have the APOE4 gene variant.
Which is a known major genetic risk factor for Alzheimer's.
Right. So in people without that strong genetic risk, maybe there was something. But for the vast majority of the people studied, unprocessed red meat intake wasn't significantly tied to a dementia diagnosis.
That is a really, really important clarification for our listeners. So it sounds like the major takeaway, the big headline from this study, is that the stronger, more consistent connection to dementia and cognitive issues was seen with the processed red meat.
Precisely. When you look across all the different ways they measured cognitive health, the core finding was that higher intake of red meat, especially processed red meat, was consistently linked with a higher risk of dementia and poorer cognitive function.
Okay, so we see this strong association from this massive amount of data. But of course, an observational study like this, even a great one, shows links. But it can't definitively prove cause and effect, right? It can't say why this is happening.
That's the key limitation, yes.
But the authors did suggest some possible biological reasons, some mechanisms that might explain these connections.
They did, drawing on other existing science. One idea relates to the high saturated fat content often found in red meat. High saturated fat intake can potentially mess with cholesterol metabolism and also contribute to insulin resistance.
But how could those issues affect the brain?
Well, both problems, trouble processing cholesterol and insulin resistance, are generally thought to be bad news for brain cells, for neuronal health over the long term. Another potential player they mentioned is a substance called trimethylamine oxide, or TMAO.
TMAO, where does it come from again?
Your gut bacteria produce it after you eat L-carnitine, which is pretty abundant in red meat. Some research, mostly lab or animal studies so far, suggests TMAO might encourage those amyloid beta and tau proteins to clump together in the brain.
Ah, the proteins involved in Alzheimer's disease. That's a potential direct link.
It's a plausible biological pathway being explored. And then, specifically thinking about processed meats, the authors pointed to compounds added during the processing itself, things like nitrites and N-nitroso compounds. These are known to potentially cause damage to cells and increase oxidative stress, which is harmful to brain tissue.
So the processing itself could be introducing specific harmful elements.
Potentially, yes. And one more factor, Especially relevant for processed meats is the typically high sodium content. We know high sodium intake is linked to higher blood pressure, and chronic high blood pressure can reduce blood flow to the brain. That's a known risk factor for vascular dementia, another common type.
Right. It sounds like there isn't just one smoking gun, but maybe several plausible ways red meat, particularly the processed kind, could negatively affect brain health over time. Did the health news article you mentioned bring in any outside expert views on these Y factors?
It did. The article quoted a neurologist, Dr. Jasmine Dow. She commented on these findings and suggested the link could be, well, either indirect, meaning red meat contributes to other health problems like heart disease or diabetes, and those conditions are known risk factors for dementia.
Makes sense.
Or, she suggested, it could be more direct related to inflammation or the fat content or the sodium that we just talked about.
So it could be a bit of both harming the brain directly and contributing to other conditions that then harm the brain. And she also made a broader point, didn't she, about healthy eating in general?
Yes. The article highlighted her point that overall healthy eating patterns are generally linked with better cognitive function. It reinforces that diet is a really significant lifestyle factor for brain health across the lifespan.
Okay, so we understand the links. We have some ideas about the potential reasons why. What does this actually mean for people listening, thinking about their own diets? What are the practical implications?
This is where the study got really interesting, I think. They did some specific analysis looking at the impact of making dietary swaps. They essentially asked, what happens if people replace some of their processed red meat intake with other protein sources? And the results were quite compelling.
Okay, give us an example. What kind of difference did swapping make?
All right, so replacing just one serving per day of processed red meat with one serving of nuts and legumes. That was associated with a 19% lower risk of developing dementia over the study period.
Wow, 19% lower risk just from swapping out one serving a day. That feels like a big potential benefit.
It really does. And that same swap processed meat for nuts and legumes was also linked to a reduction in cognitive aging equivalent to about 1.4 fewer years and a 21% lower risk of that subjective cognitive decline.
So potentially substantial benefits from what seems like a relatively small daily change. What about swapping for other things like fish or chicken?
Good question. Replacing one daily serving of processed red meat with fish was associated with an even more impressive potential benefit, a 28% lower risk of dementia. And get this, a 51% lower risk of subjective cognitive decline.
51%. Cutting the risk of feeling foggy by half just by choosing fish instead of processed meat for one serving a day. That's quite powerful.
It really highlights the potential impact of which protein source you choose. Swapping processed red meat for poultry, like chicken or turkey, was also linked to benefits that showed a 16% lower risk of dementia and a reduction in cognitive aging equivalent to about 1.3 fewer years.
These substitution numbers really bring it home, don't they? They offer very concrete, actionable insights. It's not just, don't eat this, but look what might happen if you eat this instead.
Exactly. It frames it as a potential win-win for cognitive health, reducing potential harm and gaining potential benefits by making those shifts.
Now, we've talked about how powerful this study is because of its size and duration, but like all research, it's important we touch on the limitations, too.
Absolutely critical. And the biggest one to remember is that this is an observational study. It tracked people and found links, or associations. It shows that higher red meat intake and cognitive problems tend to go together in this group, but it cannot definitively prove that eating the meat caused the cognitive decline.
Right. There could be other factors involved. Maybe people who eat a lot of processed meat also have other lifestyle habits or dietary patterns that contribute to the risk, even if the researchers tried to account for those.
Precisely. They did adjust their analyses for a whole range of other factors, things like overall diet quality, smoking, physical activity, medical history, education, lots of things. But it's practically impossible to perfectly isolate the effect of one single dietary component over decades. There could always be unmeasured factors at play.
Okay, that makes sense. What about how they collected the diet info?
Another limitation is that the dietary data relied on self-reporting people filling out those food frequency questionnaires. And anytime you rely on people remembering and reporting what they ate, there's potential for inaccuracies, right? People might forget or underestimate or overestimate.
Sure, that's always a challenge with diet studies.
It is. Though it's worth noting, the researchers pointed out these specific questionnaires have been validated and are generally considered pretty reliable for ranking people's intake in large groups like this. They also did some extra analyses looking back at diet reported earlier in the study, and the results held up. That suggests the findings probably aren't just because people with early cognitive issues were misreporting their current diet.
Okay, that adds some confidence despite the self-reporting. Any other major limitations we should mention?
Just the population studied. It was largely made up of white health professionals. While this group provided really detailed health data over many years, which is a huge plus, it does mean the findings might not perfectly apply or be generalizable to people from different ethnic backgrounds, different socioeconomic levels, or those with very different cultural dietary habits.
That's a fair point. The results are strongest for the group they actually studied. So, okay, taking all this information, the strong findings, the potential reasons why, the substitution benefits, and the limitations, where does this leave us? How does this fit into the bigger picture of brain health advice?
Well, this research adds really strong long-term evidence, specifically pointing towards processed red meat as a potential risk factor for dementia and cognitive decline. It definitely reinforces broader dietary advice aimed at protecting brain health. And the health news article we mentioned also brought in some wider expert recommendations for lowering dementia risk overall.
Right. What other kinds of things do those experts typically suggest based on that article?
They really emphasize adopting healthy overall dietary patterns. The MIND diet was mentioned as a good example.
Ah, yes, the MIND diet. Remind us what that focuses on.
It combines parts of the Mediterranean diet and the DSH diet. It specifically encourages eating plenty of leafy green vegetables, other veggies, nuts, berries, beans, whole grains, fish, and poultry, usually prepared with olive oil. The article quoted another neurologist, Dr. Verna Porter, who basically said, dietary patterns like MIND are linked to lower risks of cognitive decline and Alzheimer's.
So it's less about obsessing over one single food and more about building that overall healthy pattern.
Exactly. And the experts in the article also stressed the other key pillars of brain health we often hear about. Things like getting regular physical activity, aiming for at least 150 minutes of moderate exercise a week. Also, staying socially active and mentally engaged, challenging your brain, getting enough good quality sleep, ideally 7 or more hours a night, and finding ways to manage stress effectively.
It really paints a picture of a holistic approach being crucial, with diet as a major piece of that puzzle, and processed foods maybe being a piece to minimize. So specifically back to the red meat question, what was the final practical advice from the experts quoted in the article?
Dr. Dow, the neurologist mentioned earlier, put it quite plainly. She recommended aiming to eat as little processed red meat as possible. And she made the point that even small, consistent reductions could potentially add up to a significant positive impact on your cognitive health in the long run.
That feels like very practical, achievable advice. And it lines up perfectly with what the study found about the benefits of substitution, doesn't it?
It really does. The evidence from this huge, decades-long study provides compelling support for thinking carefully about our dietary habits, especially around processed red meat, if we want to protect our cognitive function as we age. The detailed findings, particularly that substitution data, offer some really tangible ways for you, the listener, to think about making those changes.
It absolutely underscores how those seemingly small, everyday choices accumulating over decades can have such a profound influence on something as vital as our cognitive future. Considering the kind of long-term impact this study points to, it really makes you pause and ask, how might prioritizing even small, consistent dietary shifts today shape your own cognitive path years from now? It's definitely food for thought, isn't it?
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.